After surgery following your procedure, you will be given a packet with specific restrictions and recommended limitations. The most important restriction is to limit your activity as much as possible for 8 weeks after surgery. Nearly every failure we've seen, whether it is our failure or one from another reversal surgeon, has occurred because the area of repair pulls apart, either partially or completely. Anytime you strenuously arch your back, twist, bend, or flex your abdominal muscles, the vas has the potential to get pulled. Even strenuous coughing, sneezing, or other small things like that can pull on the vas. Now, you will still have to go on living your life. Activities of daily life for the most part are okay, walking and gentle stairs are fine, but you really want to completely restrict things like strenuous jogging, running, heavy lifting, hiking, rock climbing, any other unnecessary activity that you can postpone until 8 weeks. After the 8 weeks, you can slowly reintroduce increasingly aggressive and strenuous activities. As far as work, the best answer here is to use your judgment. If you have a desk job, most men will feel comfortable going back to work in 2 to 3 days or a week at most. However, if you need to do more strenuous activities, you should request either time off or the ability to restrict what you do at work. At the end of surgery, you'll have a sterile dressing in place. You can remove this in 24 to 48 hours and can resume showering at that point. You should, however, avoid baths, hot tubs, saunas, or any other activities that may heat the scrotum for 1 to 2 weeks following the procedure. Pain after surgery is normal, generally very mild with vasovasostomies, and moderate with complex repairs or epididymal vasostomies. You will, however, be given a prescription for narcotics if needed. However, most men do not require anything beyond Tylenol for pain control. Following surgery, if you choose the standard reversal, we will give you take-home semen analysis kits. These allow you to collect the semen analysis at home and send a sample directly to our clinic for analysis. We usually have you check as early as 2 weeks, then periodically at 3, 6, and 12 months. Primarily, we are observing concentration only. A more formal semen analysis, if desired, can be conducted at your nearest fertility center. Sperm can continue to increase even 3 years after the procedure, but we have a set criteria for success at around 1 year, meaning that if we don't see sufficient sperm by 1 year, we would consider the surgery unsuccessful. The reason we use the 1-year cut point is because people need to move on with deciding on IVF or not if it's not clear if the surgery is successful at that point. Other information will be provided in the take-home packet that you'll receive after surgery, and if you continue to have additional questions, you'll also be provided with a cell phone number that you can contact after hours or even on weekends. All of this information and more will be discussed and reviewed thoroughly by our surgical assistants and providers with you on the day of your procedure. We welcome any questions before, during, or after the procedure. The line of communication is always open. Thank you.